I'm very grateful to organizers for having me here. I'm not really a CBT therapist. I'm more of a child and adolescent psychiatrist with a lot of interest in how to better help children and their families to better cope with the diverse disorders that they may be challenged with. And it was interesting to me to share with you these few thoughts about how powerful is parenting support is to treat child's psychopathology. Let me remind the definition of parenting according to Wikipedia. Parenting is the process of promoting and supporting the physical, emotional, social, and intellectual development of a child from infancy to adulthood. Parenting here refers to the intricacies of raising a child and not exclusively for a biological relationship. We don't mean just the fact of being a parent of this child. We mean all that we can do and that we can live as a parent with this child. With regards to child psychopathology, for long periods of time, parenting has been accused with the scope of psychodynamic approaches as being the cause, the main cause of the child's disorders. Parents were hence accused to cause their child psychopathology through their unconscious thoughts and projections. Means when they welcome the child, they already have a lot of projections around that child, and these projections and these unconscious materials can cause disturbances in the life trajectory of the child. Their own histories may interfere with the child's history. Their attachment to the child and the modality of this attachment can be a major cause of disturbances. And finally, their practices and attitudes regarding that child that may change his trajectory from a normal developmental pathway to a pathological one. Many therapies for child psychiatric problems were hence mediated by parents, like, for example, the little Hans phobia of horses that was treated by Freud only by talking and analyzing the material brought by Hans with the father, with Hans' father, and with no direct meeting with Freud as a therapist and the child. This, if not achieved through actual therapies for the parent themselves, here the child is seen as a symptom, l'enfant symptôme, as if he's displaying the symptom that the parent should have displayed. This trend was followed by decades of exclusive biological approaches to etiology and treatment. In this period that may cover the years 1980 and 1990, most of the etiologies and most of the interventions were exclusively based on biological approaches. But since the 2000s, parents and family came back to the center of the circle and were offered again key positions, but with different angles here, with a better focus on the parenting support and training rather than the parent being a cause of the disorder. Let us just remember briefly how we do figure out and how we do structure the childhood mental disorders. It's more or less a reminder of the basic components of the mental health, what we think, what we do, and what we feel. So regarding what we feel, emotional part, we talk of internalizing disorders. This relates to anxiety, such as separation anxiety disorder in children, or depression or dysthymia. What we do refers to the behavior, and here we talk about the externalizing behaviors or the externalizing disorders, such as ADHD, attention deficit hyperactivity disorder, one of the major field of intervention when we talk about parenting programs and parenting support programs, oppositional defiant disorder, ODD, and conduct disorder. The cognitive part, what we think and what we say, can cover areas such as autism spectrum disorder, expressive language disorder, reading specific disorder, and all the learning specific disorder, and so forth. ADHD here, in the with the shadow of what we know about the development of attention and executive functions, may also be seen as a neurodevelopmental disorder, and the behavioral part of it is less regarded now by research as one of the most important determinants of this disorder. So let's talk about the general principles of the parent support programs. We know that parenting can be seen as a biological function. Okay, parenting is initially biologically determined. We know that from what we know about attachment in animals, for example. The, the babies and the pups of the animals will, will be strongly attached to an adult based on some determinants, like, for example, the imprint here in the goose. The mother goose will recognize the small gooses with an imprint, red dot on their front. But also we have in our own behaviors as human beings, in our own old reflexes, the grasping reflex or the grasp reflex that is seen as a reminiscent form of the grasping that apes, baby apes, should have developed to remain within their mothers and attached to their mothers. Attachment is an important part of the parenting history and is recognized as being biologically determined. We also know that one of the major components of the parenting behavior determined by oxytocin liberated by the brain and by the hypothalamic and the pituitary gland. And this can result in, for example, some strange behaviors that we may see from time to time in the nature, where under strong doses of oxytocin, some mothers from some species may rear and take care of babies from other species, like we see here on the pictures. Yes, okay, parenting is biologically determined, but it can also be learned. And this is one of the major teaching of last year's researchers. For example, this important study dating back to 1997 by Michael Meany in Canada and co-workers showed that even though we can inherit some aspects of parenting, parenting can be changed with epigenetic mechanisms. Here, for example, pups of low licking and grooming mothers, rat pups here, for example, were taken care by high licking and grooming mothers. So let me just explain this. These researchers have been studying the behavior of mother rats and have seen that we can roughly divide those mother rats in two groups. The one that is licking and grooming more than the others, the pups, and this was a genetic difference. So you have the low licking and grooming and the high licking and grooming mothers. So what happens if, for example, a pup of a low licking and grooming mother is taken care of by the group of the mothers from the high licking and grooming mothers group? Here, the experiment showed that these pups developed better hormonal response to stress because under the effect of these maternal behavior, they became more resilient to stress, but also in their way of being later parents, they became high licking and grooming mothers as well. They learned from this experience how to become a different parent. Further evidence for this important aspect of parenting being learned is that monkey females, for example, that took care of their younger siblings with their mothers, will be more efficient mothers later when they become adults and mothers themselves. Multiparous mothers in humans face less educational challenges and better promote autonomy in their offspring. One of the aspects related to parenting is the parenting style, based on disciplinary strategies, relational warmth, communication style, and expectations regarding control and maturity of the child. Research is conducted by different psychologists led to the definition of four major parenting styles. The authoritarian style, these are parents saying, to make it very simple, I'm the boss, what I say is the truth. They are very rigid, they use punishment, and they're autocratic. Versus the authoritative parents. These are also parents that use rules and also structure the life of the child, but they're more flexible. They would explain why this behavior or this behavior has been more encouraged, and they will also be more keen to pardon the child if the child misbehaves. The permissive parents are parents with no guidelines, non-directive, and these are poorly involved in solving problems. They're over-involved in letting the child doing whatever the child wants to do, but not really likely to solve the problems and would let the child take the lead. And the fourth group, added by Maccabee and Martin in 1983, is the uninvolved group with parents very passive and neglectful. So, the major basis for parent support interventions come from different theories: developmental psychology, systemic psychology principles, behavioral conditioning, especially the Skinner operant conditioning, positive psychology, and group dynamics. You have to at least know some of the aspects of these different disciplines to put it together parent training programs or parent support programs. The setting of these programs usually refers to group interventions. Some of the interventions can be conducted individually, like, for example, parenting coaching or guidance. But most of the evidence-based interventions are, as I said, group interventions for a small number of parents with weekly sessions over periods of time that may range between 3 to 6 months. And in order to improve the access and generalization of skills that can be taught during this program, there's now a clear trend to add to these programs internet resources, phone assistance, and even home visits to supervise the skills that have been taught during those programs. The structure of the programs, we can have parent training programs that can vary from very highly structured, for example, the Barclay programs for ADHD, to the moderately structured, for example, the COPE program from Chuck Cunningham, also for the disruptive behavior, mainly ADHD and opposition. This is an example of a very effective intervention called Triple P. And Triple P here, for example, that is very predominant in some countries like Australia, for example, can go from a very simple intervention based on teaching the parents some communication strategy, some advices, to go with the very specific and complicated situations to narrow the focus on some training skills or do some intensive family interventions. The target population of these programs may be just aiming at the general prevention from mental disorders. Usually the target population is here consistent in preschoolers, because we want to intervene early on and prevent the disorders from developing later. This is, for example, the major target for important interventions like Triple P, as I said, or Incredible Years. This is the name of another program that is prevalent in the United Kingdom. And otherwise, we may target the parents of children with specific conditions, for example, attention deficit hyperactivity disorder, autism spectrum disorder, anxiety, drug abuse, etc. The major values of those programs are to promote positive attitudes and practices, promote empathy and adequate responses of parents in interaction with their children problems, privilege rewards over punishment, ignore provocation and remove reinforcement for disruptive behavior, because many parents simply reinforce some behaviors by giving them more attention than they should. Foster common pleasant moments shared with the child in leisure activities, cooking together, playing together, and so forth. Help structure time and environment of the child. Provide feedbacks, and this is an important part of the parenting program, to teach the parent how to, for example, give verbal feedbacks to the child, so that the child uh, uh, be conscious of what is happening and why the reaction is like this, and control emotion expression, because in many situations, high levels of expressions of emotion can be very negative on the situation of the family. So let us just see briefly some of the major programs regarding some specific conditions. So I'll be using the same slide as I used for explaining the general psychopathology in children, and I'll be focusing on ADHD and oppositional defiant disorder for the externalizing disorders, on anxiety for internalizing, and autism spectrum disorder for the neurodevelopmental. ADHD. So if we say ADHD and we say parent training or parent supporting program, the first author that comes to the mind of most researchers and practitioners is Russell Barkley. Russell Barkley is a major author of ADHD, and he developed the Barkley's parent training. So these are highly structured programs with well-defined components of the sessions. Parents usually follow precise instructions and learn interactive schemes regarding the management of their child misbehavior. So here the parents will be really guided with clear instructions: do this, don't do that, say this, don't say that, reward your child when he does this good behavior, and you may use this gradual approach of, for example, consequences. We don't say punishment, we can say just timeout, and then if timeout doesn't work, you may do some privations and so forth. The Barkley programs are very spread over the world. Some experiences have even conducted in similar countries to Israel, like for example in Iran, the clear evidence of efficiency in reducing the symptoms of ADHD, improving social skills of children, reducing behavioral problems among students with conduct disorder, improving parental satisfaction and self-efficacy, and the overall sense of parental competence, and reducing children's emotional and behavioral problems. On the other side, many parents and many researchers and practitioners complained of the high structuration of the Barkley program and developed less structured programs. This is an example of what the COPE program in Ham, and I'd be very pleased to say more about this program in his French version called Equipe, that I was trained to in Canada. This is targeting small groups of parents that may be together at weekly sessions. They sit together around tables, in 5 to 6 parents per table, with a facilitator for the whole group, and one of the parents becomes the facilitator for the small group. So we have what we call the Socratic discussions leading to proposed solution. Here, we don't receive very clear instructions. We want the parents out of some problems that can be brought through video records or some discussions about some situations. We want the parents to come to the solutions. This is a very efficient program that has been published as efficient in reducing conduct problems, hyperactivity, impulsivity, daily problem behaviors, and in reducing also the parental stress and improve the lack of perceived parental control. However, the program was not effective in reducing inattention, social competence deficits, or peer problems. Switching to autism here, this is not really a parenting or parent training program. The Early Start Denver model is a comprehensive and naturalistic developmental model of treatment that incorporates many aspects. So when we talk about autism, we have the behavioral approach based on prompting some behaviors in the child and then reinforcing them backwards with very concrete reinforcers that can be even food reinforcers or more social, like for example, thanking behavior and so forth. This is a major component of what we call applied behavior analysis, ABA. So Denver model came after ABA, used some of the elements of ABA, but focuses more on building strong positive social relationship with caregivers. ESDM, Early Start Denver model, aims to increase the rates of development across all domains and decrease the core symptoms of autism. The new thing is that ESDM focuses a lot on parent intervention. Parents are reinforced in trying to implement some basic components of the development of the child that is lacking in autism. For example, symbolic play, pretend play, declarative behaviors, showing things to the others, using the gestures that may be used in communication. And the curriculum checklist of the ESDM consists in skills to be taught in receptive communication, expressive communication, social skills, play skills, cognitive skills, fine and gross motor skills, and adaptive behavior. And this will be spread over age frames that may vary between 12 and 48 months. ESDM in the recent studies is one of the most important and evidence-based interventions, and results may even reach figures like 50% of improvement in many groups or over there, which is a very important figure when we talk about autism. For example, in 2009, Bismara and co-workers conducted a pre and post study examining the efficacy of a 12-week low-intensity, 1 hour week per week of therapist contact parent training study, in which parents were taught to use the SDM, and this was very shown as an effective, and the parent training here is becoming a major component of this program. Last disorder to talk about is anxiety, and I will refer to this recent study published in 2020 by this group of authors around Eli Leibovitz in United States, and that used, rather than a cognitive behavior therapy directly with a child with anxiety disorder, they used a parent-based treatment. So they compared the two interventions, rather to go through the parent or to work directly with the child in a very classic cognitive behavior therapy. So they tested the effect of providing parent training in the absence of child-facing CBT, and program was developed with an emphasis on the reduction of one of the major etiological factor of a child anxiety, which is family accommodation. Family accommodation refers to parental behaviors that reinforce children's anxieties and help. It was a 12-session training. SPACE is the acronym of this program versus 12-session CBT program face-to-face with the patients, and both reduced child anxieties, resulted in similar reduction in family accommodation, and were acceptable and satisfactory by clients. So as we see in this brief overview, that in conclusion, we can say that parent support through parent training programs is becoming a major tool to prevent and cure child psychopathology. Research is very promising, and challenges can be Now, related to the access to such programs, because as we know, implementing this in community may be very challenging. One, due to the level of engagement some parents will want to do, some will not, but also to the resources that may be used and training to be provided to different stakeholders. With this, thank you for your attention, and I wish you a pleasant conference.